doing, but not talking. So whoever you can see best, all right? So we're gonna look and make sure you have, we're just sitting there quietly looking. Do you have your watch with a second hand with you, and do you have your stethoscope on? Are you doing the alcohol-based wash right and putting on your gloves? We will not say anything to you during the entire competency. We're quietly watching and grading as we're going along, okay?
Come in.
Good morning.
Hi, how are you?
Hi, I'm Nina from Respiratory Therapy. I'm here to just see how you're doing, see how your breathing is, listen to your lungs, and probably give you a breathing treatment if it sounds like you need it.
Okay.
Can you tell me your name and date of birth?
Joan Horse-Camp, 61464.
Okay, great. And let me just see your ID and double check that. Great, great. So how's your breathing feel?
I was kind of wheezing all night long. I haven't been feeling good. I've been feeling tight. My chest kind of hurts.
So how do you feel compared to when you first came in?
Kind of the same.
You do?
Mhm.
Okay, all right. Okay, well, I'm going to do a couple of tests with you just to see how well you're breathing.
Okay.
First one I want to do, I'm going to be looking at your windpipe here, and I just want to see if it feels straight to me. So you're going to feel me put my
Nobody's ever done that
hands.
before.
Yeah, we're going to do a complete assessment.
Okay.
Okay?
Okay.
So what I'm going to do is put my hands above, right below your neck here, and just push slightly and see if I can feel your windpipe
Okay.
back here. Okay, so I'm going to touch your shoulder here. I'm going to feel down here. Okay, put just a slight amount of pressure there and track up. Okay, that looks good. So your windpipe is, sometimes that can move around if there's some problems in the lungs.
Okay.
But that looks good. All right, next thing I want to do is to see how well your lungs expand when you take a deep breath in.
Okay.
So I'm going to ask you
You want me
to
to
turn
turn
in
around?
your chair. Yeah, or you can, yeah. All right. Okay. So what I'm going to ask you to do, I'm going to put my hands on the back of your chest, okay? And here, you're going to go about ½ inch below the scapula. That would be about T8, okay? And thumbs are going to meet and the hands are going to go to the side. All right, I'm going to ask you to exhale, Miss Horkstamp. Go ahead and breathe out, okay? I'm going to put my hands on your chest. Now take a big, deep breath in. Excellent, and let it out. Okay, even though you're wheezing, I know you're a little uncomfortable, everything's moving the way it should.
Okay, good.
And now what I'm going to do is I'm going to ask you to say the words 99, and I'm going to feel all the way down your chest, your back, just like this, okay? And what I'm feeling for is if there's any sort of abnormality inside the lung. All right?
Okay.
So can you say the words 99?
99. 99. 99. 99. 99. 99.
Okay, all right, good. I know you're wheezing again, but still, I can feel what I'm supposed to be feeling back
Okay.
here. Okay, so it's probably a little better than what you actually think.
Okay.
All right, so now I'm gonna listen to your lungs. And what I want you to do is take a deep breath in and out through your mouth, okay?
I'm just going to lay back. Is that all right?
No, I need you to sit forward for me while I'm doing this. All right, are you okay sitting forward? Okay, good. All right. Now I'm going to listen over Joan's clothes. Normally you would try and slip this in underneath the gown, okay? All right. So again, we're going over the clothes. Breath in and out through your mouth. Ms. Horskamp, can you, I just need to listen under the breast. Can you just take your hand and move it over slightly, just a little bit, move your hand a little? Okay. Big breath in and out through your mouth. Okay, and now what I want you to do is just rotate your shoulder blades a little forward. And I'm going to listen to each side here.
Turn
Okay,
around.
yeah, that would be great. Okay.
So forward.
Just rotate your shoulder blades forward, just like that. That's perfect. Big breath in and out through your mouth, please. Good. Really big through your mouth. Okay, I hear a little bit of wheezing. Okay, good. All right, great. Okay, you can have a seat. Now, there is something that I did not do. What was it?
Heart rate?
Heart rate and respiratory rate, okay? Because I was focused on the breathing. So how would I check the heart rate?
The radial artery.
Okay, all right, and how long, so I would take her wrist, okay? Feel for the radial artery, and how long would I feel for?
30 seconds.
30 seconds, and then the second 30 seconds, what would I do?
Respiratory rate.
Respiratory rate.
Can I
Okay,
lay
good.
down and do that?
Nope.
Okay.
Sure, even if the person is sitting up, make sure you say, I wanna sit you up. That's a point. Make sure you say that to the patient, I wanna sit you up, even if they're sitting straight up, okay?
Okay. So now I'm gonna end this by saying, you know what, I think we're gonna give another breathing treatment right now, just to
Thank
help
you.
with your wheezing.
Okay.
So I've done the breathing treatment, you don't have to say that. And then I say, is there anything else I can get for you, Ms. Worsted?
No, you've been really helpful, thank you.
Okay, good. Do you have any questions for me?
I don't think so, not right now.
All right, so you're gonna see me probably in about 2 to 3 hours from now, just so we can stay on top of this wheezing.
Okay,
Okay?
thanks.
All right, so I'm gonna take my gloves off, okay? And you guys are going to be, are we doing the gowning up?
I think that's part of it.
Yeah, gowning up,
You're gonna
okay.
gown up, so you're gonna take
Okay,
it down
and
gloves
then,
off.
before I leave the room. All right, Ms. Swartzkamp, have a good day.
Thanks.
All right, we'll see you later.
Good job, Nina.
All right, so did we hit everything?
2 identifiers, huge.
Yeah.
She did the 2 identifiers, she introduced herself, where she's from, that's huge. And she told me what she was going to do, she was just going to evaluate me and give me a full assessment, okay? She auscultated me, so it doesn't matter, she auscultated me, whatever way you do it, it's okay. As long as you auscultate, she did the tracheal, right? Make sure my trachea was in line, okay? She palpated my back. Had me exhale first, take a deep breath in. You should have even expansion between your thumbs. So and then she did her percussion. Okay, you know she did side to side, side to side. Okay, don't forget when
I
you're
missed the percussion.
percussion, yeah,
Mhm.
percussion, side to side. So practice that at home with your family members and go through the whole thing. Okay, it's on Blackboard, what you're required to do. And then study your PowerPoint a little bit stronger so that you can answer all the questions and do really well on your competency.
So percussion, if we were gonna do percussion, okay? All right, so I'm going to stay in the alley, okay? Middle finger, all right, down, and I can either do the tap with my thumb, I don't find that as easy to do, or 1 or 2 fingers over the nail. Okay?
The other thing, when you're auscultating, one of the other things that we look at is positioning, right? But also have them lean forward so that you move the scapulas out of the way. Make sure you say that so you're moving forward.
Right,
That's
tell
part
them
of the
to
position.
shift their shoulders
Lean
forward.
forward, move their shoulders forward. To
Okay.
get the scapulas out of the way so you're listening to lung. Don't listen over the scapula, because you'll get points taken off. Because the student will tell us, they listen below my ribs. Okay, so they listen to my liver, they didn't listen to my lungs. So they can feel where you're listening.
Right, and
So make
many,
sure,
yeah, and many people are in a rush and they lift off the stethoscope before the patient's exhale.
that's important too.
Right.
Listen for a full cycle, inspiration and expiration, and then move to the next spot.
So you're gonna introduce 2 patient identifiers. Tracheal position, thoracic expansion, palpation, okay, and percussion, which I missed, and then your auscultation. 4, 2, and at least 6 in the back. Now, when I listened, I went 8 points in the back, okay? So as long as you hit the 6. And then you take your gown off and glove and wash hands afterwards, okay?
Any questions? Okay, so it'll be next Monday, so we're gonna practice